we have Dr. Alyse Cameron, who is our Black Ferns team doctor and is a sports medicine physician. In the middle, we have Julia Casadio, who's a sports performance physiologist and founder of Her Strength. And just to my right, we have Maumahara Keelan, who's a sports and musculoskeletal physiotherapist. So please join me in giving them a round of applause. You know, it's not just about getting girls into sport, but it's about keeping them there and making sure they feel safe and supported to be themselves. But, you know, as many of you know, the dropout rate for girls in their teens is really high. It's around 49% in New Zealand that a teenage female will drop out of sport in their teen years, which is 6 times higher than their male counterparts. So just passing to the panel, what do you guys think is going on here and how can we change that?
I'll kick it off. So research has looked at the reasons why are girls dropping out so rapidly during adolescence, and it shows that there's 5 key reasons, and I'll just share them with you because it's actually encouraging that you as a room can have impact on these things. So the first one is social pressures, so friends. If their friends are not in sport, they're likely going to start drifting away. Then it's perceived competence, physical factors, not wanting to be judged, and outside competing priorities, so things like school and stuff. But those middle 3, the perceived competence, not wanting to be judged, and the physical factors, those things we can really make an impact in, and whether you're a coach or a parent or you're another leadership role within the sport environment. So I think while it's startling statistic to see how many girls are leaving sport, it's encouraging that actually you can make a difference for these girls by improving their enjoyment, making it more fun, making it more inclusive, making it supportive, and kind of some of those physical factors that become an issue for them, just being able to talk about those things.
I suppose from my lens, so I wear a lot of lens. I've worked in, physio, but from a Māori Pacifica lens, like, I think there's 3 big things that stand out. So whakapapa. Whakapapa is like, who am I? What am I here for? So children, like, when they're in that adolescent era, they're still figuring themselves out. So as coaches, as managers, like, plug into your athletes and who are you, where do you come from, invite their families, like, create a safe zone for these athletes, especially in the adolescent area, create a safe zone for them so that they it's a home away from their home. And sometimes home is not a comfortable place, so maybe creating a space for them. I always think that's a good stage where you can really plug into them. Where do you come from? Who do you belong to? You remind me of someone. And you can really instill good values into these beautiful adolescents and keep them in sport. That's my theory.
So we're actually gonna start at the beginning, really with puberty. And this can really be a make or break phase in a young girl's sporting journey. But many coaches still feel unsure about how to support athletes through this phase. So Julia, much of your work with Her Strength is centered on this age group. So what are some of the biggest changes, happening during puberty that coaches often underestimate or might miss?
Right, so there's a number of challenges that are unique to young female athletes that are going through puberty. First of all, they get taller before they get stronger, unlike boys who have more testosterone, they get taller and stronger at the same time. We also have the widening of the hips. That changes a lot of things temporarily for sport. Running mechanics, landing mechanics, some of their coordination. And so with those 2 things, they are at an increased risk of injury. And so coaches being able to spot when there's a sudden increase in training load, that's really important because that's when they're at risk. And so just, coaches don't really know how to adjust the training for puberty. They know maybe what's happening in puberty, but they don't know how to adjust it in the sport context. So that's one thing. We then see other body shape changes. So development of breasts. Girls put on body fat, and they need to put on body fat to be healthy and to be able to get their period. And that's really normal, but it is a big change for the girls. And so, being in comfortable kit, Do they have a supportive sports bra in rugby? Do they have a sports bra that has protection? And those things are available. Other things around getting their period. So they get their period, and it's not the same for a teenager as it is for an adult female, because they're more sensitive to estrogen. The estrogen receptors it's like, oh, what is this going on? And they can have more severe symptoms. And it's also irregular. The first couple of years, it's quite unpredictable when they're going to get their period. So all these things, there's a stat that 6 in 10 sporty girls will sometimes or always avoid training or their sport on their period. That's quite high. 6 out of 10 sporty girls. We're not talking about the others. And so it's just, how can we normalize the conversation? How can we talk about this so it's like they're not the only one dealing with these things by themselves? So there's lots of opportunities in this space. And there's lots of challenges as well.
Well, thank you so much for sharing those tips, and that there is a lot of opportunities to really strengthen athletes through their teen years, and share that they're not alone in that journey. So Mo, from your work, what signs do you see in young athletes who might be struggling emotionally or physically through these years?
I suppose being a Māori health practitioner, again, I'm connecting to these athletes, these young, beautiful adolescent females, and I create a safe space so we openly talk about it. A good example is, I work in elite sport, but I also look after my daughter's kura team, and if they get their period, it's openly spoken about, like it's not a bad thing. Like when you get your period, it's like, well, we can carry on our seed, we carry on whakapapa. So their worldview is like, oh, I've got my period. And I was like, kei te pai, when we just make sure that they're comfortable, it's almost like I'm stronger when I get my period. Or like there's a different worldview, and some, and then it's a hassle as well. But I know a few that's like, I feel stronger when I get my period. I was like, oh, that's choice. So they openly talk to me about it. That's from my worldview. However, it'll be good to speak it in a positive light rather than, like a taboo.
Celebrating these things.
That's right, yeah.
Love that. So we're just going to move on to menstrual health. Looking at the menstrual cycle, it impacts mood, training, recovery, and confidence. And the menstrual health is still a really tricky topic in many sporting environments. Taboo, as you mentioned. But if we avoid it, we are missing the chance to support our athletes holistically. So Alyse, I'm going to pass to you on this one. So what should coaches understand about the menstrual cycle when it comes to training, performance, or even injury risk?
This is going to be medical lesson 101. And I just want to echo what Mo said there. Periods are a good thing. We like women having their period. For me, from a medical lens, it tells me that their energy in is matching their energy out. So the first thing that the body shuts down or stops wanting to do is stops its reproduction system from working. And that's when your body is in low energy. So maybe you're doing too much exercise, you're out in the field a bit too much, you're not getting enough energy coming in. Your body goes, hold on, we need to save our energy for our vital organs. I'm going to send that to your heart and your lungs and brain. I'm going to stop you from having a period because I don't think we're in a state right now to have a baby. So I know historically there used to be this view out there that you're not training hard enough if you're still having a period. That's absolutely wrong, and I really want to make sure that's never heard of ever again. So periods are a good thing. But also, like we've already mentioned, periods are not the same for everyone, and this can be a different effect, not just physically, but also emotionally, psychologically. Everyone is different, and especially through those teenage years when hormones are still settling. This can be variable for everyone, so understanding that there's not a cookie-cutter sort of thing to expect around that time. Signs and symptoms that something's not right. Again, thinking medically, this could be that they're having a lot of pain, heavy bleeding, maybe missing their periods, maybe a bit of emotional dysregulation around certain times. And my advice on that is if it's happened, if they come and report it, thanks for reporting, that's awesome. Thanks for sharing that with me, really empower them, good that you're having a period. if it's happened for 1 month, let's just monitor that. Let's just see how things are going. But if we're seeing a bit of a trend and this is happening now over 2 or 3 months, that's a sign to me that we need to look into this further. And the first point of call I'd recommend would be that you're getting that individual to see their GP to kind of have a workup to see if there's anything else going on, like endometriosis or polycystic ovary syndrome, something like that. So, that would be my take on that side of things.
Awesome. Thank you. So Julia, how might we break the silence and stigma around periods in a team environment?
Yeah, so this is a tricky one, and there's a lot of false assumptions from both athletes and from coaches that has been shown in the research. So players, for instance, will assume that if it's important to talk about, that their coach will talk to them about it. And they also have the false assumption that it's something that they don't want to talk about. Okay, so that's interesting. And then you look at the coaches, and they also have false assumptions. So they assume that they shouldn't talk about it, and they assume that if the girls want to talk about it, they'll come to them. So, there's multiple barriers here, and those are just a couple of them. But I guess it's really just kind of acknowledging the importance for coaches and leaders in the sports space to acknowledge and understand the importance of the menstrual cycle for health, and health is always first before performance, but that it also impacts training and performance, and that training can impact the menstrual cycle. So it's quite relevant in sport, and so coaches that don't feel the confidence or they don't feel like they have the understanding or knowledge, they just need to start learning. And there's lots of resources and tools out there for coaches to learn. And then the next thing is to just have a bit of courage and be brave and be like, okay, in a team environment, maybe if you're working with young athletes, maybe you've got the parents there, but you're like, we're gonna talk about this. This is a safe place where we can talk about the menstrual cycle. You all are experiencing it, and we can talk about it. And some of you might have symptoms that impact you and make you feel like you have low energy, or you're in pain, or you don't want to do the exact training that we have planned today. But you can tell me, and we can adjust it. We'll reduce the intensity. We'll make it more recovery focused, because some movement actually helps symptoms. You can say, I've got period products in the first aid bag that's at the field every day. Okay? It's there for you if you need it. I've got a spare change of shorts too, if you need it. And it's just the girls. So every girl will have a different experience, as Alyse was saying, and every girl will also have a different experience at home in terms of how much this is talked about. So for the girls that have parents that talk to them about it, they have a bit more confidence, and it's just normal for them. So those girls will just start piping up, and they'll be like, oh yeah, blah, blah, blah. And so the girls that don't talk about it at home will be like, oh, look at them, they're like me. Yeah. and they'll start, the conversation will start. So it's really like the simplest thing about the stigma is actually just giving your sport environment permission to talk about it and recognizing that it's actually really important.
No, that's brilliant. It's starting the conversation, having the courage to start it. And what advice might you give a male coach about starting those conversations?
I guess if you're feeling like you don't have the confidence, it's probably because you don't have maybe a lot of knowledge, and just find some adult females that you can talk to about it, and ask them questions. You got questions like, oh, what about this? What about that? And then if you still are really feeling like, nah, I don't feel comfortable in this space, find someone within your sport who can be a female champion for this thing. Maybe it's an assistant coach, maybe it's a physiotherapist, or maybe it's a parent who's really involved, and they can work alongside you to still address it. So there's lots of options, and it's kind of a thing that instead of feeling uncomfortable about it and you just avoid it, try to put something in place, even if it's someone else.
And I think you said earlier, there's lots of opportunities for learning, lots of resources online, but also a lot of people around you. And you might not be the most knowledgeable in the room, but it's about starting the conversation. All right, so we're just going to move on to pelvic health now. So pelvic health is one of these topics that affects more athletes than we realize, but really, again, rarely gets talked about until there's a problem. And pelvic health isn't just about postpartum recovery, but it affects many active women and can impact performance at any level. So Mo, what kinds of pelvic health concerns do you see in your practice, even among athletes?
Well, the majority are mainly postpartum, like you were saying. I'm just trying to think of the ones that are outside the box. I think for our community, like young girls, some period pains, like I'm sore. Back pain can also kind of may point to issues in the pelvic region. Trauma, like some people, they don't want to talk about it, but it does come out eventually in my room. So, of all levels. So not only our babies, but also like elite levels. Eventually it comes out when they find that safe space, they tell me. So I have seen a lot, and we deal with it together as a family, or basically together, and just guide them safely through that. And asking their permission, you've got a coach. Shall we talk this through your coach, or do you want to go and talk to your coach? So I'm always right there with them. So they've always, because sometimes it is trauma, and it's like, but it's affecting their performance. So we've got to support them in that realm. But I suppose that's the main. You want to see you want to see like period pain. You don't want to see the other pain. So yeah, we see it all.
Gosh, I'd love for you to be my physio. You just bring everyone along for the journey. Alyse, I might pass to you on this, and I know you're doing quite a bit of work in this space right now. I'd love to share some of those nuggets wider. So what are some of the signs that an athlete might be struggling with pelvic health issues?
Yeah, thanks. I think the first thing is to understand what we mean by pelvic health. So when I talk about pelvic health, I'm thinking about the pelvic floor, the muscle sling that sits within the pelvis. And the pelvic floor muscle sling is important for holding up the organs that sit within a woman's pelvis. So our bladder, our forgetting the organs, bladder, rectum, and uterus. So it's not just an area that we do think about in postpartum women, although there is a high level of pelvic health issues in postpartum women, because there's obviously been a lot of pressure on this area and therefore some changes there. But also we're seeing a high level of pelvic health issues in elite athletes. And the current research shows that up to 80% of high professional athletes are having issues within this area, and that's across all sports, not just rugby. And these issues can be that the muscles in that area are actually overactive, and this can be seen in like a positional thing from on a rugby field. There's certain positions that may be overactivating their pelvic floor more, and therefore are getting symptoms around this area. So when I think about what symptoms someone might be displaying if they're having pelvic health issues, it can be urinary leakage, it could be incomplete emptying of their bladder, it could be just a pelvic heaviness or a pelvic pain, or it might be pain during sexual intercourse or something like that. So as you can see, these are really hard signs and symptoms to pick up from a face kind of interaction. Some signs you might see within your players on the field is you might see some visible leakage around that area. I have seen players have leakage and then quickly grab a bottle and spray themselves down so no one can see it. So that might be a behaviour you observe. They might be going to the bathroom more often than normal in a training session. But yeah, it's a really, really difficult area to pick up. So within the Black Ferns environment this year, we're actually running out a screening questionnaire that's asking about these specific questions and points. And it gives the individual time to look at it and see, and then if they've answered yes to one of those main symptoms that I mentioned, then we arrange an onward referral to a pelvic health physio. So it's not an easy thing to pick up, but there are resources out there and ways that you could screen, and these can be included in medical screens if you do them within your clubs. Or again, just that education and discussion that, hey, look, these are symptoms, something may not be right in this area, and there is help out there. As a first step, being a pelvic floor physio is a great option, or the GP to discuss it further.
That's really awesome. And it might be, I think you mentioned this earlier, it might be certain movements where it's more present. Jumping is often a really common one, running. Rugby's a high contact sport. That they might get a really hard hit.
Yeah, front row scrumming, that contraction movement
Yeah,
repetitively.
Yeah, that core tightening, everything's at 100% there. Yeah, we covered that. So we're just gonna kind of wrap up this section, and then we'll jump into the questions after this. So we're just gonna move on to culture, equity, and inclusion in sport. So not every athlete comes from the same background, and that matters. Cultural context, access to care, and community norms all shape what health support looks like. So Mo, we know that we don't come in parts, and that health is holistic. Can you explain to us the intersect of health and culture, and why this is important, and how it plays out for our young wahine?
This is a huge question for me. But I'm going to try and keep it real simple so that it hits everyone. Have we all seen Avatar? Has everyone seen Avatar? All right. So you know how the Avatar people get their ponytail and plug it into the horse, or plug it into and they connect. So connection is huge for anyone. So for me, as a Māori Indigenous woman, I try to connect to every single patient that comes through the door. I try to connect. So every elderly person I treat as if they were my nana. If a child walks in, I treat them as if they were my child. So you've got to go in with that amount of empathy from a coach, from a manager, from an athlete. Plug into your athletes. Because I could go on about culture, it's my thing. But how do I grab it so that it will be understood by everyone? Even my Korean would understand that. So I have athletes from all over the world that play basketball, and they all get it. So when they're playing on the court, I know that something's up, because I can tell just by the way they're walking. That's how we all need to address the athletes or the people that you work with. Plug into them, get to know them. That's the simplest way I can put it.
People first.
Yep.
I love that. So we are going to open this up for questions from the floor. And I know some of these subjects we've discussed today are a bit taboo. So if you are nervous, this is a really open space. And I'm sure if you guys have thought of the question, someone else in the room is thinking of it as well. We've got an amazing expert panel up here. So if there's any dying questions that you guys have thought about, please jump up. We do have some roaming mics around the room. And we'd love to hear any questions from the floor.
So where would you go to get assessed, on the pelvic floor sort of side of things? Because when you just said prop, I'm like, oh shit, yeah.
Yeah, I think the first step would be to see a pelvic floor physiotherapist.
Yeah.
So these are physiotherapists that have trained within this area, so it's their specialty. Mo, you might be able to tell me a bit more about that side of things. And they will do history, they'll have a chat to you, understand what's going on. Part of it does involve an examination, and we always warn our players that there will be an examination. They don't have to have the examination if they don't need to, understand?
That's right.
Yeah. And then from that, the pelvic floor physio can develop a treatment plan that's individualised for that player. Yeah. So pelvic floor physio. There's some in most regions. Yes.
I know there's actually a database that is available. Oh, do you?
We all know about concussion and the concerns parents have over their girls playing rugby. Is there any other part of the body that there can be concerns, like around the breast area and the pelvis area, for long-term damage on females? I get a lot of grandparents asking me this question. They obviously don't like their grandchildren playing rugby, so there is concern over there about a general well-being of a teenager that is going through puberty. Is there any research done on concerns? Should they be wearing a breast pad? Just your thoughts.
Yeah, feel free to jump in, Mo or Alyse. But I guess breast protection is available from a lot, it's emerging in a lot of different brands. I don't know all the companies that are doing it, but there's one called QP Sport, which is down in Taranaki, and they have some pretty good products that are very suitable for rugby. So that's one thing. Janelle, you were talking about concussion, which Janelle's a specialist in that. But ACLs is another one that Mo or Alyse might be able to speak to. And then the other thing that Alyse mentioned was just and this is for any athlete, whether they're in rugby or another sport, is just that whole energy in versus energy out. And if they're not getting enough fuel for the energy that they're expended with school and training and growing and just being alive, there's a lot of different things in terms of energy needs, then their bone health is at risk, and that can have long-term consequences, because between 10 and 20, they're getting the most build-up in their bone mineral density until they get their peak bone mass. And if they're not eating enough, they're going to have a lower peak bone mass, which is always going to put them at risk for fractures their whole life, which is like a big one that we always are trying to speak to people about so they have awareness.
One practical thing I talk to parents in clinic is that a adolescent or someone until they're skeletally mature, so till they're 20, 21, shouldn't be doing more hours a week than their age. So if they're 15, they shouldn't be doing more than 15 hours a week of physical activity. And that takes into account walking to school, PE at school, playing on netball at lunchtime or whatever they're doing. So that's a really cool rule of thumb just to keep in your back pocket.
Yeah, I totally agree. I love this.
Don't worry, it stops at 20.
Another biggie would be make sure your children are strong for their sport. So a lot of kids just play sport, but they forget there's actually like quality movements, balance, strength, coordination that comes with sport. So a lot of parents are really keen, my daughter's really good at this, and they chuck them into everything, but they're missing the gist, like the main foundations of being an athlete. So yeah, that's awesome.
And I just add in, probably along those lines, is the movement competency, that as they're going through these structural changes, as their hips are widening, that their body's still learning how to coordinate. And I guess from the coaching side, it's really focus on good movement competency rather than adding a lot of volume. We want to ensure that the athletes are moving well, that they've got that really good foundation as they're going through the sport. And then I was going to just add in the bra fitting side. World Rugby and New Zealand Rugby are going to be releasing guidelines around bra fitting, guidelines and things like that. I'll just speak briefly about the concussion side. We do see a slightly higher rate of concussions in female athletes. That's due to a number of different factors. Part of it is structural differences between males and females. Within rugby, looking at the years of experience that an athlete has. If you look at an 18-year-old male, many of those athletes have been playing the sport for 10 years already, but the rate at which a female accelerates and moves through rugby is very quick, which has really guided us into the development of programs such as Contact Ready to ensure that they are getting those good skills in how to take the ball into contact and tackle. I think we will. We've just got a couple minutes here, so I'm just going to pass back to the panel. And I'd like you guys to share kind of one final thought, a take-home message that you'd like everyone here to walk away with. Alyse, I'll pass to you.
Mine is just to start normalising these topics that we've talked about. There's plenty of resources out there. World Rugby this year are rolling out, or have already started rolling out, educational resources. There's webinars and there's one-page handouts, which are fantastic, on breast health, bra fitting, menstrual health, pelvic health, and they can be a really good resource to start by sending around your clubs and your teams, and to start that conversation, to start that normalisation, and then it then creates a bit of a pathway for that discussion. And if there's any questions of where to go after that, your GP, local physio would be fantastic at helping in the next steps.
I'll just say, the one thing I'll say is that because we lose so many girls during adolescence, this is a huge opportunity for us, and we can have a huge impact in this space by doing really simple things. So if you work with young girls, I encourage in 2025 that you just learn a little bit. Learn a few different tools that you can use to help support them, because if you can keep them in sport, we know that that's going to change their life in a positive way.
I'm going to speak to the Indigenous people in this room and just to anyone that takes care of Māori Pacifica women. First things first, I'm Māori, I'm female. I remember one of my friends, Rachel Taulele, said, "Maumahara, you're a unicorn." And I said, "What do you mean?" She goes, "Do you ever go to hui and you feel like you're out of your league or out of..." I said, "All the time, every day." And she goes, "Yeah, you're a unicorn. I'm a unicorn." So she goes, "Do you know what a group of unicorns are? You know, you get a pack of dogs. Do you know what a group of unicorns are?" And I said, "No." And she said, "A blessing of unicorns." So each and every person in this room today is a blessing. I call you guys unicorns because you're doing something different for our females in sport. So, mauri ora.
Awesome. And I just wanted to highlight, this is just the start of a much wider conversation for New Zealand rugby. As Emily alluded to, we are going to be releasing a digital health hub with resources that are available online. So stay tuned for that, and we will be releasing webinars later in the year. So this is just a start, and there's going to be lots more knowledge and learning opportunities throughout the year. So please join me, and a round of applause for our great panel today.